And a simple blister can take you down. It can turn into an infection, which can turn into gangrene, which can turn into the need for an amputation, etc. In today's society, we don't think about that. 200 years ago, everybody knew that. But if you're going to have enough macaroni and Kraft macaroni and cheese put back for 3 months if you need it,
Yeah.
wouldn't it make sense to have your blood pressure medication, etc., back as well? Because, either one, starvation or a stroke can kill you. And if you're saying that these situations do not provide for access to emergent care, well, guess what? You're now the emergency physician.
Yeah.
So what are you going to have? What should you have for that? And again, when I say prepared, of course, the first thing that some people are going to come to mind, oh, these are preppers. This isn't really prepping. This is just a couple basic things. If this is prepping, so is having Band-Aids in your medicine cabinet.
Welcome to the Suburban Sheepdog channel. If you've been along for the ride, you know I'm Grant, the host. So this is episode 2 on lockdown medicine. So we have an episode that preceded this, and we had a trailer as well. So I'm not sure if you're watching this in order. If you're not, just go ahead and watch it and then double back, and I'm linking to episode 1 and the trailer down below. And really what we're going to do is we're going to talk about how we become our own physicians, our own first responders in medical emergencies and or just the maintenance of our health during a pandemic lockdown. I'm talking serious lockdown to where you either can't get out, don't want to get out, or there's nothing to go out for because the supply chain's been interrupted. So Dr. Mike's going to walk us through this. You're jumping into the middle of an interview. Just kind of keep that in mind. But this is going to be valuable. In fact, it was so valuable to me that when I went through this, I realized, wow, I've got some work to do. I think when you watch this, you may have sort of the same feeling. So let's let this roll. Dr. Mike, you're up to bat.
And by the way, you used the term trauma. That was actually the second part of what I was saying. The one was infection, the second was trauma.
Right.
And with things like that, there's the basic things where you can set up a splint if you hurt your knee or if you break a leg. And with that, there's some basic things you need to know. If you have a fracture in a limb, I actually saw a movie recently where the guy broke his leg and they had 2 pieces of wood, one on each side and some rope around it. That does you almost no good. You have to actually get across and immobilize the joints around the long bones, or else you're going to keep torquing them and exacerbating the problem. And when you have a fracture of a long bone like that, just so people know, when you try to splint it, it's not just because you don't want to hurt badly and you may have to get moving. It's also because you're trying to protect soft tissues, because you have bone fragments there. When the bones move around, can start cutting up. It's basically a knife. Can start cutting up soft tissues. Can cut a nerve, and now you can't move your leg. It can cut an artery, and now you're in real problems, etc. So you're really protecting the soft tissue. So yes, you need a splint often across the joints around the bone as well. Otherwise, you're not doing any good.
I would not have known that.
Yeah.
My medical training on that probably is from Hollywood, so I appreciate hearing that.
And then when you're talking about a joint, you hurt your knee, you twist your ankle, and it's swelling up, and you have trouble. You're going to want to immobilize across the joint, which means the bones away from it, or distal as we call it, farther away, and closer up. So if you have your knee gets damaged badly, and you're going to put a splint on that, it has to go across the whole knee and go into these bones and goes into these bones as well. If you're doing your elbow, it has to go cover this and it has to come over this, which is why you always see people with their arm like this when they have a problem with their arm or their elbow, etc.
Right.
And then there's the potential for bleeding, which of course can lead to a abrupt demise. The basics always apply. You apply pressure directly, you apply pressure to the artery that's feeding that area if you can. But there's one device that I've found kind of interesting, and it's called the Israeli bandage or Israeli device, and it's a designed by the Israeli military years ago, and it is a sort of a stretchy bandage that has a gauze pad, a pad that can go over a bleeding area. And what happens is you put it on the area that's bleeding, you wrap it around, and then it actually has cleats that go around on either side. You put your bandage through, and then you pull it back through. which just because of that design now is you can pull down and you can tighten up as much as you want.
Right.
You wrap it around
Right.
a few more times, and then it has a couple more cleats that wrap on. Now, when you say bleeding, you hope it's smaller vessel rather than larger. You don't want to lacerate your femoral artery. You'd really rather have cut your calf a little bit. But
Right.
either way, bleeding, as they say in medicine, all bleeding stops. You know,
For one reason or another, right?
So, you'd really rather be it because of you.
Right.
Yeah, so those are the type of things you need to be on top. So for that, and for a lot of different things, just some basic gauze bandages, some of the ACE wraps, the stretchy ACE wraps, the kind of light brown things. That,
Right.
things like that you can use to hold a splint in place, hold a bandage in place.
Yeah.
Those are the type of things you keep in your closet in your bathroom,
Right.
along with your medicines, etc., that you can be on top of these type of situations should they arise. Because, as the idiom went, for the want of a nail, one little thing you didn't consider,
Right.
and it blossoms into something that ends up being potentially fatal. Well, have the nail. Just
Right,
get
right,
the nail
right. Yeah.
and take care of the problem early on, and you won't have to deal with all that stuff later on.
And in light of that, and in preparation for the interviews, I did just a little cursory homework looking for ways to suture, right? I mean, none of us want to suture ourselves. We've seen Rambo or whatever. It just doesn't look fun. But if you had to, so probably none of us could do a good job. We don't have the equipment, But I did see some really interesting alternatives out there that I'll link to. They seem reasonable alternatives if you can't get sutured.
Yeah, those are for posing skin and subcutaneous tissue, which means a pretty minor wound.
Right.
Which is fine. If you have a little thing, that minor wound can become ugly and major. So yes, some way to pose the wound and then get some Neosporin on it and keep yourself out of trouble.
Right.
But if you have a deeper wound, you really have to get down to the fascia and stuff like that and get that held together, else it's going to eventually unravel on you.
Yep.
But yeah, for the more superficial stuff, yeah, there's those type of things that can be done. And although it would be terribly uncomfortable, I'm sure, if you don't have local anesthetic, which is another thing if you can get access to and know how to use it. Not a bad thing to have around, in case you do have to, do some
And we're
debridement
talking
of wound.
lidocaine type stuff?
Lidocaine, yeah, things like that.
Yeah.
But yeah, even if you couldn't, anybody who knows how to sew can actually do those superficial stitching. It may not be a plastic surgery closure, of course. It may not look good down the line, but in terms of actually just getting the thing to a pose to heal, if it's not too deep, yeah, somebody can do that for you,
Right.
who's sewn before.
Yeah, and that brings up the next question, and that is when to stitch and when to not. I mean, what kind of a guide would we, as a layperson like myself, when would I say, well, I got to have stitches here? Is it because it won't stop bleeding? Is it the size, the depth? What is it?
Yeah, I don't know if I can come with a hard and fast rule with that. I mean, if it's deep enough, like I said, the superficial stitching is probably not going to do enough, and you can't do the deeper stitching, so you're kind of stuck with that. Some cases you don't have to stitch at all. It's more of a cosmetic thing than anything else. But yeah, I don't know if I could come with a hard and fast rule about
Fair enough.
how many days or how many hours
Or how big or how deep?
Yeah,
So, Dr. Mike, this has been real good. Kind of feeling like we're near a wrap, but can you think of anything else that maybe people ought to know, or things that they might want in their medicine cabinet?
Yeah, I suppose it depends on what you already have there, but a lot of the things we're talking about are things that you may have had in your cabinet for some time, maybe didn't use and forgot about, and may find yourself in a situation where, boy, I wish I had not forgotten that. So basic things like Tylenol, ibuprofen, something to treat mild to moderate pain if you sprain your ankle instead of just putting ice on, if you can get ice. Something you can treat fever with like that. If you are on blood thinners, or if you have a history of gastric ulcer, you can't use the ibuprofens, the Aleve, the aspirins, so you're left with Tylenol. But yeah, something basic like that, just to handle you get a headache, you hurt your back, or make sure you have some of that still. You're not down to the last 3 pills and didn't realize it in your medicine cabinet. That is so simple and so inexpensive that just go ahead and get that now. When you're picking up your Neosporin, you're picking up your ACE bandages, some gauze bandages, in in the cart, throw in some Tylenol and throw some ibuprofen in as well. And you're not spending much money and you're set. You're ready for a lot of the basic problems that can and will come up.
So Dr. Mike, thanks a lot. Appreciate your time. I know the audience
Pleasure.
does. A lot of good information there, and we're going to find a way to get that out in bits and pieces so that it's YouTubeable. Okay, so there you go. That's a wrap on episode 2. And I hope this was as valuable to you as it was to me. In recording this, I realized I had some gaps, and I'm working on filling those in. But some really, really good information there. Again, I'm linking to episode 1 and the trailer down below. Thanks so much for being along for the ride. This was a great series, and there are more to come. So subscribe. Go ahead and subscribe. Hit the notification button. We'll see you down the road in another episode. Thank you. God bless. And stay safe.